Hello, my name is Phoebe Campbell, and today I will be discussing some basic fall prevention techniques and how to prevent falls on the nursing unit. As well, we will be looking over how one can be a high fall risk, what assessments can be done to determine if someone is a high fall risk, and what we as healthcare professionals can do to prevent falls on the nursing unit as well as home. The goal of this presentation is to design, implement, and evaluate fall prevention methods set in place on the nursing unit, and also describe fall prevention techniques and ways we can prevent falls on the nursing unit. The three learning objectives are to be able to identify strategies to help prevent falls, being able to assess and identify someone who has an increased risk for falling, and provide education and fall prevention interventions. By completing this presentation, you will be asked to complete a short quiz on fall prevention. All questions will be answered and clarified. You will be able to assess and identify someone who is at an increased risk for falling, and you will be educated and return demonstration given on fall prevention techniques. So, what are the outcomes for nursing units and fall prevention? With these strategies implemented for every patient at an increased risk for falls, a nursing unit should be at a decreased risk for falls, and most importantly, a decreased risk for falls with injury. With this education provided, nurses can take what they have learned and begin implementing each step and standardize this with each patient interaction. More education given would cause for a safer and more comfortable stay for each patient, and nurses who attend this presentation can give feedback and proceed to educate their patients on the importance of fall prevention in the hospital and at home. So, why is preventing falls important? Fall prevention is a serious topic to consider at any age and at any point throughout life, but it is more prevalent as we begin to age, especially in the 65 years or older. More than 1 out of 4 adults fall, but less than half tell their doctor. 1 out of 5 falls causes a serious injury such as a broken bone or head injury. This broken bone is usually the hip or the wrist, and each year at least 300,000 are hospitalized with hip fractures, and more than 95% of hip fractures are caused by falling, usually sideways. Falling puts one at greater risk for serious injuries or medical conditions such as a head injury like a hemorrhage or a TBI, traumatic brain injury. Education and fall prevention greatly reduces one's risk for injury by fall because falling once doubles your chances of falling again. So, what can cause someone to fall? Now, here we're going to look at what can cause someone to fall, and these risk factors are the top ones I found. So, lack of exercise and weakness. Now, when people are afraid of falling, this can become a problem because they will start to become less active in their daily lives, not moving with their daily activities, and their muscles tend to grow weaker and their bones start to grow stiff. This makes it harder for them to move around. Balancing issues are an unsteady gait, so when they walk, they might lean to one side more, or they might start leaning back when they stand still. This can increase the risk for falling completely backwards. Dizziness or lightheadedness. People with medical issues might feel dizzy, the main one being low blood pressure or hypotension, or orthostatic hypotension, which is when you go from a lying, sitting, or standing position, your blood pressure drops pretty drastically in a short period of time. Usually this drop is about 20 or more points, so if a person goes from 120 over 80 lying down, and when they stand up they're 90 over 50, this is a positive orthostatic because it's such a big jump. Problems with feet or nervous issues. This is talking about people dealing with neuropathy, especially in the feet, causing pain, numbness, or tingling, making it harder for them to feel the ground they're walking on. So if someone's walking and they can't feel their ground or their feet, this can cause a fall. Confusion and memory problems definitely makes it easier to fall, and not in the sense that the person is unsteady, but because they are confused or a little turned around. If they get up in the middle of the night thinking it's daytime, they go wandering in the kitchen or heaven forbid down the stairs, they could hurt themselves. So it is really important for the nurse to assess one's mental acuity when talking about falls. Bladder or bowel problems. Now this is talking more about frequency or urgency when someone's needs to use the restroom. They might have to get up rather quickly, and we have to assess they forget to assess their physical surroundings, so they could trip on any fall hazards nearby. Vision problems, so it makes people more difficult to see. So when it's dark, the use of night lights is really important, especially in the high traffic areas, bathroom, bedroom, hallways, etc. And medications, and this, in my opinion, this is the biggest one, biggest risk factor for falls, and requires the most patient education, because sometimes patients don't know what medications they're on or the certain side effects that the medication can cause. Talking about sedatives or anti-anxiety meds, lorazepam, diazepam, sleeping aids, Ambien, trazodone, the old-fashioned antihistamines, Benadryl can cause drowsiness. Beta blockers, metoprolol, any of the LOL drugs can cause low blood pressure. And narcotics, the big one. Narcotics, Dilaudid, morphine, oxycodone, hydrocodone. The codones can cause sleepiness, possibly can cause some confusion, so we really need to assess if they need that drug at all. So now we want to determine if someone is a high fall risk. At many facilities, there are protocols in place to follow to determine if someone is a low, medium, or high fall risk. My facility uses the Johns Hopkins Fall Risk Assessment Tool, which measures based on assessment and history if someone is a high, low, or a low, moderate, or a high fall risk. Now we are going to ask, have they fallen within the last 6 months to a year? This answer will determine a lot because if it is yes, that already puts them at a higher risk for falling. Ask about past medical history. Do they get dizzy when they stand? Does anyone in their family have a history of falling? Assess mobility and gait. Now this is important so we can see how someone walks. When doing this, we want them to use any assistive devices they might use at home, a walker or a cane. Have them walk away from you and assess their gait. Are they shuffling or leaning to one side? Are they not picking their feet fully up off the ground? And make a note of that. Also watch when they get up, when they fully stand up, see how long it takes them. Are they alert and oriented? Can they answer questions appropriately, or is some confusion going on? Ask gently about their bladder or bowel regimen, again looking for any urgency or frequency, and review all medication for potential side effects. Now, how do we want to prevent falls? Let's go over some education in regards to fall prevention at home. Staying physically active so again the patient doesn't grow weak and their joints become stiff. This can include walking, water aerobics, tai chi, yoga. These activities help prevent falls but also improve strength, balance, coordination, and flexibility. Using assistive devices, walkers, canes, handrails up the stairwell, non-slip tread on hardwood floors, a raised toilet seat or one with armrests so the toilet's not so low and they can just pull themselves up. Grab bars in the shower or the tub, and possibly, if needed, a shower or bath chair. Remove any hazards. Clean all walkways, those high traffic areas. Move all boxes, newspapers, electrical cords, phone cords. Secure any loose rugs with a non-slip tread, or remove the rugs altogether. Repair loose or broken floorboards or carpet. Store clothing, dishes, and food, and all other daily necessities in easy to reach places so that we're not climbing on any stools or chairs to reach high areas. And always clean up spills immediately. Light up your living space. We talked about night lights in the high traffic areas. Use lamps. Make sure lamps are accessible. The walkway to the lamps are clear, and the walkway to any light switches on the wall are clear and free of clutter. Wear sensible shoes, sturdy flat shoes with a non-skid sole, and socks with the grippies on them. Okay, education for the nursing unit. Now this is where us as nurses can implement these fall prevention techniques. Now, based on where you work, your policies might be a little different regarding fall prevention techniques, but these are some universal ways we can prevent them. Familiarize patients with their surroundings. This is a big one for the confused patients to make sure they are reminded of where they are in the hospital versus at home. Demonstrate how to use the call light and call for assistance if needed. Maintain side rails up. Now, at some facilities, 4 side rails is considered a restraint. At mine it is, so it has to be 3 out of the 4 can be up at all times. 4 is a restraint. With some people, they can throw themselves over the side rail, and that could land them flat on their back on the floor. So the use of fall mats is a good one. Fall mats can either be on 1 or 2 sides of the bed depending on the policy, and they just cause a cushion on the floor, and they add grip to the floor. Keep frequently used items within reach. This call bell, cell phone, chargers, water, anything they might need when they're in bed. Use non-slip socks when ambulating out of bed at all times. Always have the bed or chair alarm on. Place a fall risk bracelet on the patient, and place a fall risk sign out the door for any other staff that come in. Maintain the bed in the lowest position with brakes on at all times. Use any assistive devices such as the bedside commode, the Hoyer lift, the gait belt when ambulating the patient out of bed. And regularly ask if the patient needs to use the restroom or needs any incontinent devices such as a Purewick. This project can help with long-term safety. These measures can help increase the risk for patients and nursing safety and increase the knowledge for the risk of falling. This project can help with lifelong learning and education by expanding researchability and knowledge on subjects needed throughout life, and research included in this project will help me through my future educational paths and can help me prepare for furthering my education. These are my references. Thank you so much for attending my presentation and allowing me to educate you on fall prevention. There is a short 5-question quiz in the comments below, so fill it out and let me know what you think. Bye!